Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Our bones, they're living tissue that is constantly being broken down and replaced. Now, when we don't make as much bone as we lose, the condition is called osteoporosis, literally porous bones. And that tends to happen as we age, as all of us age, but it is much more common in women than in men.
Yes, osteoporosis causes bones to become weak and brittle, so brittle that a fall or even mild stresses such as bending over or coughing can cause a fracture. The good news is osteoporosis or brittle bone disease can be effectively managed or even prevented. I'm all ears.
That's the good news.
Here to discuss osteoporosis is Mayo Clinic endocrinologist Dr. Bart Clarke. Welcome back to the program, Dr. Clarke.
Thank you. I'm happy to be here.
Dr. Clarke, always good to see you. Always good to have you on the program, particularly talking about a problem that is as common as this. So as we get older, our bones tend to become porous, they become weak, they become brittle.
Correct. And so this process starts in most of us in our mid-50s and then progresses as we get older unless we do something to prevent it.
You're not even there yet.
I'm on my way. Why do women suffer from this more than men?
Right. The view currently is that it's mainly the estrogen deficiency that develops at menopause that causes bone loss, at least for a period of time, perhaps 10 or 15 years after menopause. And at the end of menopause, of course, bones are much thinner than they were before menopause. In men don't lose testosterone quite the same as women lose estrogen in most cases, and so they're relatively protected against severe bone loss.
So it's estrogen that's the culprit?
At least at the beginning. Now, the view is changing on this, and there's recognition that there's many other factors that are aging related that take over probably 65 to 70. And it continues to be estrogen deficiency, but there's other factors that are added in to accelerate the loss.
And we guys, we keep producing testosterone, which helps protect our bones, huh?
That's correct.
Are there other risk factors other than being female?
Yes. So there's a number of diseases that will accelerate bone loss because of the nature of the disease. So we're thinking about things like type 2 diabetes mellitus. We're thinking about things like hyperthyroidism, hyperparathyroidism.
Overactive parathyroids, overactive thyroid.
Exactly. And there's a number of other things as well. If you have a low calcium diet, a low sodium diet, I should say high sodium diet, or a low vitamin D intake, or you're not physically active, all of these things accelerate bone loss.
Symptoms? Unfortunately, isn't it true that sometimes it's asymptomatic until something bad happens?
Yes, this is one of the silent diseases that you wouldn't know you had it until you break a bone or you get your bone density checked to find out. But most people who have osteoporosis don't know they have it because they haven't fallen and broken something yet, or they haven't been tested.
So are we talking screening needs to be done? Is that what we should be doing?
Yes. So national guidelines exist for who should be screened. If you've never had a fracture, the recommendation currently by most national organizations is age 65 for women and age 70 for men.
So even though men aren't nearly as likely to get the disease, they should be screened.
Yeah, there's guidelines that would recommend that.
Age 70.
Age 70.
And 65 for women. And it's called a bone density scan. Why are you laughing?
I just said we're making sure of the ages.
Closer,
that's all I'm saying. Okay. Okay, so then why is it that, when I'm going into menopause, I should be worrying about my bone health?
Well, because the natural consequence of estrogen loss, stopping making estrogen on your own, is that, yes, you get hot flashes, you may have mood swings, you may have other symptoms, but as a consequence of the estrogen deficiency, bones will start diminishing or decreasing over time.
It feels like I shouldn't wait until 65 then.
Well, there's good evidence to think that if you have risk factors before age 65, it would be reasonable to check your bone density around the time of menopause.
Okay.
And if you check someone's bone density and you notice that they have osteoporosis or early osteoporosis called osteopenia, what do you do?
So once that condition is recognized, then the question is it severe enough to intervene with medication? Most of these people would normally be recommended to optimize calcium and vitamin D intake, physical activity if they haven't already, and then depending on the severity, make a decision about whether medication is actually required.
Can you prevent the bone loss?
Yes. So all the medications used to treat osteoporosis, if you took them earlier in life, would prevent it. Now the question is the risk of fracture high enough to make us recommend the therapies? Because they all have risk, they all have expense, and there's the benefit to be had, but that's always couched in terms of how bad the risk is.
Now, suggesting that people take calcium and vitamin D, that suggests that we don't get enough calcium in our diet, or a lot of people don't.
Yeah. In general, most Americans would have about half the intake of calcium through their diet that is recommended for their age. And this is particularly true in people as they get older. So most women past age 50, the recommendation currently is 1,200 milligrams of elemental calcium a day. Most of us in our diets, based on national dietary surveys, get about half that. For men, it's about the same.
When you talk about calcium and recommend calcium, there's so many different kinds. How do you know what kind to take, and why do you need the vitamin D?
Yeah, so vitamin D is needed to help absorb the calcium, and phosphorus, it turns out, too, because phosphorus is also involved in the bones. For calcium intake, you can modify your diet. It's more palatable and nutritionally better probably to do that. But if you can't or don't want to, then you can take a supplement. And then among the supplements, calcium carbonate is by far and away the most common. It's easily absorbed, convenient, 1 tablet per day, usually of 500 or 600 milligrams is sufficient. If you don't absorb things well, or if you don't have very much stomach acid, we usually recommend calcium citrate, and that absorbs better.
And if dairy doesn't work for you, there's other foods that have calcium in them. What are some of those?
Yeah, very much so. So green vegetables, many of them have reasonable calcium intake, but things like broccoli, spinach, Brussels sprouts, and kale are all high calcium foods. There's a number of cereals and breads that are supplemented, and fruit juices that are supplemented with calcium. You can buy almond milk that's calcium supplemented now. So there's a number of other foods that if you can't take dairy, you're lactose intolerant, you still can get the calcium through your diet without actually having to take a supplement.
Can you rebuild your bone density?
Yeah, if calcium and vitamin D aren't enough, you've got some pretty powerful medications, don't you?
Yeah, so the issue is, when we look at a skeleton in the doctor's office, it looks like rock, and we assume that the skeleton, the bones are non-changing. But in the living person, the bones are very much like every other living tissue. We can lose bone density, but we can gain it as well, as long as circumstances are right. So by giving adequate calcium and vitamin D intake or supplementation in conjunction with medication, the medications will build bone density, strengthen the bones, and markedly reduce the risk of fracture in the future.
Is strength training good for a good bone? Because producer Jen and I are in a Power Woman strength training class, and we want to know that we're doing it for a good reason.
Yes, so power training would be excellent for bones. Anything that puts stress or strain on bones is good. Now the question is, how weak are the bones to begin with? And if they're weak enough, you have to be careful how much you lift, how much you do. But in general, strength training is good for bones, as is walking, by the way.
Hey.
Well, there you go. Any weight-bearing exercise. Swimming, not so good.
It's good for the aerobic capacity, as is bicycling, and the stress and strain on the bones is a bit less because of the buoyant effect of the water, or because you're bearing weight on your hips, not so much your feet.
So after you do the bone density test, then you can recommend a regimen, and it might just be calcium and vitamin D, but if the problem is worse, then you've got some prescription medications that can actually build bone.
Yeah, so there are 8 or 9 currently approved medications out there with a range of strengths. Some are less potent, others are more potent. There's a range of side effects and cost attached, and so those are the discussions you should have with your primary care physician to see what's recommended.
You had mentioned when we were talking about risk factors, is there hereditary?
Yes, so it turns out your bone density measured, about 60 to 80% of that comes from genetic inheritance. The other 30 to 40% comes from things that happen during our lifetimes, medications we take, diseases we acquire, things we do or don't do that would affect bones.
All right, well, keep up the exercise. Sounds like it's the right thing to do.
So stiff and sore today. Today's not the day to have that discussion.
All right, we've been talking about osteoporosis, treatment and prevention with Mayo endocrinologist, Dr. Bart Clarke. Dr. Clarke, thanks so much for being with us.
Thanks for having me.